Bunions are a painful deformity at the base of the big toe. Bunions are hereditary. Bad shoes may not cause bunions, but can certainly make them worse. Surgery is the only way to treat this condition. Podiatric surgeon Dr. Ben Wehrli discusses his innovation, which gives the surgery a better outcome and quicker recovery for the patient.
Bunion is a deformity that you'll see kind of typically a bump on the base of the big toe joint. That's what most people see outwardly. Really, it's a lot more complex than that. You have a deformity that has multiple planes that deformity's in, and it entails a couple angles between other bones and position, and most importantly is rotation of that metatarsal bone, that first metatarsal bone.
Dr. Wehrli examines some of the problems with standard bunion surgeries.
If you really look at the literature, there's probably about 40 to 50 different types of bunion procedures out there. And when you find that there's 40 to 50 different types of bunion procedures out there, typically it's because none of them really work well. And that's kind of what I found. You know, bunion surgery early in my career was very, not reproducible, a little bit unpredictable as far as outcomes. You can always get the toe to look great, but sometimes there's a stiff toe or there's pain or the deformity came back with time. There's one surgical procedure where they corrected the deformity completely, but it was hard to fixate it. So there's hard to do the osteotomy, correct it, and then keep it stable while it healed. And so I developed a plating system that was specifically for that. So we can correct the deformity. We have a stable fixation that allows them to weight bear right away. And what I found, it dramatically decreases the amount of swelling and pain associated with the recovery. So we get these patients back on their feet quicker. They're able to get back into regular shoes quicker than the other traditional procedures. And the incision is a fraction of the size of what it was traditionally.
Dr. Wehrli reveals his improvement to the bunion procedure.
This bunion plate that I invented and developed with Trilliant Orthopedics, essentially what this does is it has all the deformities built in to correct it. So it's been mapped to look at what the true deformities are, and then simply undoes the deformity that's there. So it's correcting the abnormalities in all three planes, which we typically have a hard time fully correcting with other traditional procedures and systems.
Results of the surgery using this system have been very successful.
What we find is that this, first and foremost, it reduces the deformity that was there. And so once you reduce that deformity, it allows people to not have recurrence of the deformity. It doesn't, they don't have any more resemblance of the bump there. The pain is dramatically better. The shoe wearing ability is dramatically better. And the best part about it is the recovery is a fraction of what it typically is. The technology is relatively brand new. We just got FDA approval for it. We're super excited about that. We've got probably about 30 plates that have actually been put in, 20 to 30 plates, with great success with it. We're rapidly doing surgical trainings for doctors so that they can start to use this procedure. The one thing we find is that it simplifies the surgical procedure. So we've taken the guesswork out of it by the system that we created.
Doctors like Dr. Wehrli invent innovative techniques and tools to improve surgeries.
And I just knew that there was got to be a better way to do it. And so I looked at different traditional bunion surgeries. I found one that fully corrected it. And the downside with that is you'd have to put a big pin in the toe to fixate it. And then you have that pin in there for 6 to 8 weeks. It's very uncomfortable for patients. And I just knew that there's something that I could create that would be very simple to do that would fix the problem. And that's what we did. We spent some time. I mapped it out. I drew kind of my vision, and then talking with the specialists and the people at Trillion Orthopedics, we were able to kind of make what was in my mind come to true that would be applicable for patients. And it's been a great success.